a leading institution dedicated to advancing healthcare through cutting-edge research and drug discovery. Over the years, NIPRD has played a vital role in strengthening Nigeria's pharmaceutical sector, contributing to the development of safe, effective, and affordable medicines.
My name is Professor Philip Gildas. I'm a pharmacist and also a research fellow in NIPRD. I graduated from University of Jos in 1991 and also from University of Nigeria in Nsukka from our MPharm, and a PhD from University of Nsukka in 2008. The renewed hope agenda is actually to make accessibility to healthcare system very easy for Nigerians, and NIPRD as one is also with the President's renewed hope agenda. It's actually to make healthcare accessible to the people and make it more affordable, which NIPRD has also aligned through its R&D. Bringing collaborating with industries and making their work relatively easy by providing services to them. NIPRD research and development also aligns to that in terms of the products and also related to the healthcare and also the excipients and other products. I think his comment as DG of NIPRD have been a great paradigm shift from other Director Generals. In the terms of, first and foremost, general welfare of institutes, the staff has really benefited in terms of the general welfare, salaries are regular. Also, training opportunities, there will be a lot of training opportunities throughout all the cadres of the staff. During his tenure, a lot of people have been able to have trainings both locally and internationally. A lot of staff you see have gone, some to India, some to China, and other parts of the world for training. And also, we also have a lot of trainings also in Nigeria for our staff. Only what we need to say is in terms of funding. If you see with DG, during his tenure, one of the major problems is in terms of funding. He has to bend back to get funding by collaborating with a lot of external agencies, international and local. Like he was able to bring down to Nigeria the expertise funds for the MLD Plus project. So with NIPRD, we go further and go very far if the federal government can also provide more funding for research R&D projects.
My name is Peter Saladoshu. I'm a research director on the Department of Microbiology and Biotechnology, NIPRD. Well, I'm a microbiologist by profession. I attended University of Ife before I later moved to the defunct USSR, where I had my first degree, second degree in microbiology. Later proceeded to the University of Abuja to obtain my PhD, also in microbiology, and I furthermore obtained fellowship at the National Institute of Health, USA. I'm a member of different professional groups. American Society of Microbiology, Indian Society of Microbiology, and also Biotechnology Society of Nigeria. Well, NIPRD has continued to play a vital role in addressing the health issues of the country. From inception, NIPRD has been participating, trying to unlock the value chain of health sectors by providing alternative to endemic diseases in our country. It has done this by making available efficacious phytomethods to combat diseases like malaria, TB, fungi, and sickle cell. Well, if you know the vision of NIPRD, the vision of NIPRD is to remain a center of excellence for research and development of pharmaceutical raw materials. And under the leadership of Dr. B. Peter Digwe, an able person and a very hardworking personality, he has contributed to this achievement by ensuring nursing security in the country and making sure there will be efforts in local manufacturing of pharmaceutical raw materials, ensuring that medicine will be available less costly for Nigerians. The Dr. Obi Adigwe has made a lot of efforts in developing policies to help this administration in achieving local production of pharmaceutical raw materials. For the years ahead, well, the institute needs to maintain the achievements that have already been achieved, one, and secondly, we need to improve on our drug manufacturing units. You know, most of the things we are doing have always been ending up in publications on the shelf, but our DMU will assist in generating more revenue and also give us visibility. You know, this will make the world to know what we are doing, just like we did for sickle cell, like in those days. DMU is a private entity. It helped a lot to make available the medicine for the class, not only in Nigeria, all over the world. That was a drug that was approved by FDA, and I believe that should intensify efforts in achievement that we have made. Under the leadership of Dr. B. Peter Adigwe, we have achieved a lot of improvements in our institute. Some of the clear things that we have been able to achieve in this administration is that we have been able to equip our laboratories with current trained equipment that has been enable us to compete favorably with our co-researchers over the world. Within this period, we have obtained in all the laboratories new equipment that is facilitating our efforts. Apart from that, Dr. Adigwe also has helped us a lot in the area of capacity building. A lot of our staff have traveled locally and internationally to obtain knowledge in our area of activities. A lot of members have been to China, Japan, other places through collaborative efforts. I think this is a great achievement. Just like I said earlier, that we need to maintain the achievements we made all along. During COVID-19, the institute was able to demystify the issue around Madagascar concussion. Apart from that, even after COVID-19, even during COVID-19, the country ran short of vaccines. And Dr. Dikwe, with his management, was able to develop a roadmap for vaccine development in the country. So these are the policies we need to maintain. We need to keep running. We also advocated for sophisticated technology transfer. Things like vaccines shouldn't just be coming to Nigeria like for filling and labeling. We, the researchers, need to obtain all the technicalities involved in making vaccine. Developing a vaccine is not is a fully process. So it involves a lot of activities. This is what NIPRD has been canvassing for, and this is what we want the government to not let all the ideas die down so easily.
I'm Dr. Olanle Kudrat Mustafa, the Director, Head of Department of Medicinal Chemistry and Quality Control. I joined the Institute 1993 as a youth corps. I finished my degree 1993 at Ahmadu Bello University, and 1998 I got my master's degree, and in 2005 I got my PhD in pharmaceutical chemistry, dwell mostly in pharmacokinetics study. NIPRD, in line with the government's Renew Hope agenda. NIPRD is a pharmaceutical research institute charged with the responsibility of research into phytomedicine development and supporting the local manufacturer. And again, we help in bringing standard into our traditional medicine development, because NIPRD is Center of Excellence in research in phytomedicine development. We have ISO 17025, so we are following the international standard in all the processes we are doing in the institute. NIPRD developed one of the phytomedicine being used by sickle cell carrier, that is sickle cell anemia patient, and of now the drug is in the market all over in the country, and we're still developing more of this phytomedicine, especially during COVID. NIPRD was able to produce NIPRD Immune, which some people use to prevent or manage the COVID pandemic. Under this present regime, the DG was able, with the government, renovate our most of our the complex. Again, we got support during COVID again. The procurement of equipment, some of the equipment that we've been aiming to have, we now have them, and we can run some tests. Some of our staff have been trained on equipment, the use of equipment. Almost all the staff were able to gain one capacity building or the other, even though it's not the same, but at least it went round and everybody was trained in one activity or the other. We NIPRD, we collaborate with almost all the universities, because most of them, their students do come here for IT, service, internship. So and again, especially in this department, they come for analysis of their products or the student projects, because most of the university, they don't have the equipment that we're having, and because of that we are at their service. We do collaborate with them by providing the services. Again, we collaborate with manufacturing company and traditional medicine practitioner, because some, they want to know actually whether their product is safe or their recipe is in order. Some do want to know whether their recipe contain heavy metals. We collaborate with NAFDAC too, because sometimes they may have some analysis to be carried out for their clients, so they do refer some of their clients to us.
My name is Dr. Henry Omorigi Elariwa. I am currently the Director of Research and the Head of Department of the Department of Medicinal Plant Research and Traditional Medicine. I've been around for about 23 years plus, and we are still counting. I hold degrees in natural and applied sciences. I also hold other degrees in management science and health sciences, as well as in education. So specifically, I hold a bachelor's of science degree in biochemistry, a master's degree in analytical chemistry, a PhD degree in organic chemistry. I also hold a master's of business admin degree, as well as master's in public health and PGDE, postgraduate diploma in education. I am a fellow of the Chemical Society of Nigeria and a fellow of the Chartered Institute of Chemists of Nigeria. I am also a member of the Royal Society of Chemistry in the United Kingdom. We are building a center of excellence in research and development of vital medicines, drugs, vaccines, biologic for the health of Nigerians and mankind generally. So what we do align, very well with the Renew Hope agenda, because the Renewed Hope agenda focuses on human capital development, economic reform, and reform in agriculture. And that is what we have been doing in NIPRD, especially for the fact that I don't know if you've heard about the presidential initiative for healthcare value chain. Specifically, NIPRD fit in very well into that initiative. In fact, I would say that the drive to promote local medicine security through local production of drugs, sit well within NIPRD vision. So NIPRD has pursued this vigorously by developing indigenous raw materials, indigenous knowledge of these materials, specifically medicinal plants. Our ethno-pharmacological knowledge, we have documented, we have conducted research to validate the essence and the correctness of what has been in use. And we've done this to support local health access One of our flagship products is now NIPRD. We call it nitrocide, and we have other products also in the pipeline. That is just one aspect. Another aspect is in the human capital development is training of building capacity of research scientists through training and capacity development, especially in the developed world. Under this administration, the institute has developed its capacity, especially the scientists in several countries of the world. For instance, one of the project ongoing is the Afrexim Bank funded facility. We are developing an API, that is active pharmaceutical ingredient research and development facility. They are multifaceted. The NIPRD achievement, Dr. Obi Adigwe has actually done a lot in this area. He has been pivotal, in fact, to the development of the Nigerian vaccine roadmap, which the European Union is currently supporting with about 18 million euros. That is unprecedented and in the history of this country, especially with regards to research and development. Another thing Dr. Obi Adigwe has also prioritized is the training of research staff. He has trained staff in India, he has trained staff even in other parts of the world, in China, in South Africa, and other parts of the world for this initiative to support local vaccines and medicine production. Because the COVID-19 pandemic actually gave us a lot of lessons as a nation. The supply chain disruption exposed several countries to medicine insecurity, and Nigeria, taking lessons from that era, has actually decided to pursue the initiative of medicine security for essential drugs. And the Institute is pursuing this vigorously with the Mother Ministry, Federal Ministry of Health, under Dr. Obi Adigwe. We are already working towards medicine security. When you talk about specific priority that we should focus on, malaria and HIV remain the number one disease with a lot of mortality in Nigeria. So if you ask me, I would say malaria is key, HIV is key. In fact, vaccines for viral diseases and other ailments are key. So, and moving away from diseases generally, we should also focus on actually promoting medicine security vigorously as a country. More than 60% of drugs available in our pharmacies are imported, and we should actually push towards reducing this number significantly. We should be looking at below 30% in a few years to come. NIPRD is a research and development institute, and without research, you cannot move forward with healthcare and pharmaceuticals. So I will say that NIPRD sit well to actually champion this drive for medicine security. So the country, the Renewed Hope agenda of Mr. President should prioritize this role that NIPRD is playing in pushing for medicine security.
Yes, my name is Dr. Bulus Azu. I joined NIPRD in February 1997, so I have been in the services of NIPRD for 29 years now. My background is pharmaceutical chemistry, and I developed career in pharmacology of natural products. That is what I have been doing and researching in that field, focusing on pharmacokinetics, drug-drug interactions, and then pharmacology of natural products. Yeah, the NIPRD vision to be the center of excellence in drug development and diagnostics key directly into the renewal of agenda, especially in the key areas of drug safety, that is medicine safety, local production of drugs, the primary care revitalizations, approach toward the use of herbal medicine in treating minor illnesses, key into it, the workforce, we are able to have a high level of workforce, and the infrastructure development. All these key into the visions, the renewal of agenda. The environment, the labs are now ambient, very good working environment. The equipment, there are a lot of equipment, especially laboratory equipment, that we have never thought we have it here in this facility. Right now we have the trained workforce. Almost all the staffs of NIPRD in key areas of research are exposed into international training, and then there are also human capital development. These are just some, but it is a wonderful upgrade that we have from previously what we used to have. Yes, we have to move to the next level of infrastructural development, personnel development, and also key into those areas, especially we are talking about vaccine development. There are areas that it is only us that can do for ourselves, being a research institute in a developing country. So if you focus on that as the strategic priorities, you'll be able to make great things to be useful to the nation and the world at large, especially those neglected diseases that the Western world will not waste their time researching to them. NIPRD, just like what we have continued to do, will also continue to support once there is no focus by bringing to fore their own expertise, especially in drug development, where we can able to solve this problem of local production of drugs needed for our population. It will also train high-level manpower so that we'll be able to key into the new research priorities that are being done now. We can also mobilize resources using our expertise, since we have the expertise to be able to do some researches that cannot be done on other basis. Yes, also if NIPRD can continue to maintain their partnership with developing partners, all the international ones like the WHO, the national like the malaria control programs, will be able to key in and also have partnership with national institutes that are into research, so that we can close the gaps that they are not able to close for the betterment of the nation.
My name is Dr. Margaret Ekpenyong. I'm a director and I head the NIPRD Research Clinic. I'm also a consultant physician. I've been with the Institute for the past 30 years, and through which I've had a lot of progress and development, and also to enhance the mandate of the Institute and make sure that The institute, of course, is a center of excellence for not just for me, but for people that do research out here. I'm a medical doctor by training, and also I have had lots of experience in clinical trial, where I've been a lead investigator, especially the past clinical trials on a very topical illness in Africa, especially in Nigeria, sickle cell anemia, where I was a clinical trial lead on NIPRD, on the management of sickle cell anemia amongst Nigerian children and adults. And that has dovetailed in bringing forth a product. They've done very well over the decades, and the drug is still in the market. I want to thank our very wonderful president, President Bola Ahmed Tinubu, GCFR. This renewed hope agenda has aligned so wonderfully well with the mandate of NIPRD, which is NIPRD is the Center of Excellence for Research and Development. Our mandate is to make sure we produce vaccines, drugs, biological products from phytomedicine, and that's what we've been doing. And by so doing, we're able to reach out to our people in our nation to ensure that the topical sicknesses or illness like malaria, diabetes, sickle cell anemia is being handled, especially from natural products. So through this institute, we're able to research into natural products like phytomedicine, and as I've said earlier on, we had a product for management of sickle cell anemia, and we've also recently been part of a robust clinical trial that on vaccines, which are the COVID-19 vaccine that we just had, looking at the safety and also the efficacy of fractional doses of COVID-19 vaccines among Nigerian youth. With this, NIPRD participated very robustly in it, and this is part of the renewed hope agenda of the president to make sure clinical trial becomes home to us here. As it is done in the global north, we're expecting that we in the global south will start engaging robustly in clinical trial. So, coordinating Minister of Health and Social Welfare, he's done wonderfully well with us to ensure this mandate is brought and done properly in NIPRD through our principal, Dr. Obiadigwe. So we are on doing what in collaboration with a lot of institutes through MOUs to ensure that this renewed hope agenda has been established in NIPRD. NIPRD has achieved a lot, under the unlocking of the healthcare value chain, which is a presidential initiative. First, we were able to have, starting from the clinical trials, which have been difficult for us. The terrain of clinical trial has been not very receptive in Nigeria. But with the rate of our wonderful DG, we'll be able to have the clinical trials done, and it brought us some infrastructure for us to be able to have a clinical trial suite, which is what we're using right now. Looking also to make sure that we involve the local pharmaceutical industries. We had opportunities as an achievement to be able to train local pharmaceutical industries to assist them to become qualified to be able to produce vaccine from our natural products. And we've also been able to do lots of trainings among the traditional practitioners for them to be able to have a good idea of what it is to be involved in drug development from the very foundation down to the tablet formation. And this has been a very, very interesting route, which NIPRD has been very involved. And finally, also, we've gotten a grant from Afrexim Bank to help in the API development in NIPRD. And that has also been
Thank you for the opportunity also to speak concerning the Institute on behalf of this department. My name is Mr. Zarma Levis Bawa Nichinia. The Director of Finance and Accounts. I joined the Institute in the year 2011. Before I came into the Institute, actually, I already having my fourth degree, BSc Accounting in 1991. I also got my master's degree in 2004. I also qualified as a chartered accountant in the year 2000. I became a fellow in the year 2016 of the same institute. I'm also a member of the Chartered Institute of Taxation. I'm also a member of Chartered Institute of Management. The Renew Hope agenda is all about seeing government making positive progress, making positive impact on the life of Nigerians. And the National Institute for Pharmaceutical Research and Development, of which I am working for, has actually over these years impacted positively in the life of the activities of the Institute. We have been able to do a lot as an institute to justify the investment of government into the institute, and that has shown a lot of positive outcome. Even though some of the things that happens in the institute were before this administration, however, the present administration has succeeded in building up on what was the achievement of the institute, because particularly in the year 2020, that was the year of the COVID, the institute actually was able to stand out as an interventionary agent that was able to address the challenge of COVID-19. Along the lines, as a result of that, the institute was able to get support from government to be able to build on its ability, the capacity of the institute, of which this present administration has kept on building upon it. Maybe one thing particularly I would like to mention in respect of the present administration. Before now, we have been struggling with our overheads, which is the key thing that enables the institute to be able to run her affairs on day-to-day activities. Before this administration, we were on just a lean amount of monthly overheads. But with the present administration, our overhead has increased with almost 700%, which has also enabled us to be able to address day-to-day needs of the institute, to enable us accomplish our targets and our mandate as a research institute. If I'm going to talk about the present DG, I have a lot to say about him because he's a game changer. His coming to the institute has really changed a lot of dynamics within the institute. His coming has enabled us, even the overhead I just talked about. It was basically as a result of his efforts, his connections, and his ability to be able to convince the authority that to be able to attend to that. So now coming to the PVAC activities. This has brought a lot of activity to the Institute, which is having high-level results that the Institute is able to accomplish. And I believe we are just starting. The main activities of the PVAC is still ongoing, and I believe in the next few periods, the real results of the PVAC will be revealed, because I believe with the signing of the MOU that have just been done recently, the real activity will start rolling out, that everybody will be able to see actually what the Institute has been doing and been able to attract to accomplish her mandate as a strong partner in the activities of the PVAC. The institute has a mandate as a research institute, and I am so sure, because I am part and parcel of all the activity that is going on in the institute, is to enhance our research ability, to be able to come up with more results-oriented research, to be able to develop products from our natural herbs, which is our main source of research. And I believe very soon there will be products that will come out of our research activities that is going to address numerous health challenges of the nation and even beyond. Because with the recent happenings and developments that there has been signing of MOU and approval of grants. By the time these grants start rolling, I'm very sure NIPRD will be able to come up with a lot of products on the table for the health benefits of the citizens of Nigeria and even beyond.
My name is Fatima Gloria Musapanya, and I'm the Director of Human Resource Management in NIPRD. I've been in the Institute for the past 28 years. Well, my professional background is HR. I started off in those days, they used to call us personnel officers. So I started as a personnel officer too. That was in 1997. And then in 1999, I got confirmed. And that was where my career progression started. So I started from the bottom of the ladder, and by the grace and help and mercy of God, walked my way with the help of God Almighty through to the top. Yeah, NIPRD vision does align with the renewed hope agenda, because looking at the value chain in the health sector, NIPRD plays a very important role in adding to the value chain in the health sector. And of course, you know, in recent time, NIPRD has been involved in a lot of the researches, especially in the area of vaccine. I know that during the Ebola outbreak, NIPRD was deeply involved in the research in Ebola. And then as recently as 5 years ago, when we had the COVID-19, NIPRD was also one of the teams alongside NIMA that did very extensive and comprehensive research into the COVID-19 vaccine. So NIPRD plays a very important role in adding the value chain of the federal government to further enhance the HOPE initiative, Mr. President. Well, in all honesty, when Dr. Obi Adigwe came on board, we were at one of our lowest in NIPRD in terms of infrastructure, working tools, research equipment, trainings, especially for our research fellows, and so on, and even the non-technical staff as well. But with the vision Dr. Obi came with, a lot of changes started gradually with a lot of difficulties. And we know that, with the paucity of funds that is being faced, he was able to, over time, do a lot of collaborations. First, starting with state governments, brought in a few collaborations. They came in trickles, and then later he expanded to international organizations and also trained the research fellows on ground to be able to write proposals and gain grants from international bodies. And that really opened up NIPRD to the world. Prior to then, to his coming, yes, even though NIPRD was out there but not very well known, but he used the media space, both the social and the print media, to really project NIPRD out to the world. So people started picking interests in NIPRD and then coming to make research, and then talking with top government officials to come in and help NIPRD so it could achieve its mandate. So there's been a lot of difference from the time Dr. Obi Adigwe came in 2018 up until now. I believe NIPRD has a lot to give to Nigeria as a nation, because I must say, and with every sense of responsibility, NIPRD has one of the best research brains we can find anywhere in the country. I know over time, even some of the top-rated universities in the country have come to try to do collaboration, seek collaboration with NIPRD. And because of the material, the human resources we have close to 15 PhD holders and quite a number who are overripe, if you like, to become professors. But because of the limitations we have, that cannot be achieved. But we have some of the best brains here who have worked here, have garnered experience, do a lot of research, do a lot of teachings, both at the undergraduate and postgraduate level. So the knowledge, the experience, the skill, the experience is there at NIPRD. So with that, if the government can really, pump funds and resources into NIPRD, I believe indeed the name we bear, our logo, as Center of Excellence, will really be Center of Excellence, not just in Africa, in West Africa, and even to the world. Because way back, and we've had collaborations with international universities. Still have, I believe, with some MOUs with universities in the United States, United Kingdom, and some European countries. So with funding, proper and adequate funding from the government, I believe NIPRD will break grounds and frontiers in the nation. Thank you.
My name is Mboma Ihani, Director Office of the DG. I started my public service career in 2002 as an administrative officer, and I rose through the ranks to the position of director. I have a master's degree in public administration. I've also attended various courses. I did a professional development course in leadership in health with the University of Washington. I'm also a fellow of Chartered Institute of Human Resources. Well, the leadership of NIPRD, the current leadership of NIPRD, has realigned itself to the presidential initiative on unlocking the healthcare value chain and has started developing innovative interventions that will align with the president's vision, such as the API, artificial intelligence, and then machine learning. Well, I will say that he has made significant contributions to NIPRD. The roadmap on vaccine R&D, we talk about the phytomedicine training under the contextual processing units, which he has done across about 20 states of the Federation. Then he has also, NIPRD has also done well in research and development of phytomedicines. We have the NIPRD board, NIPRD Moon, and NIPRD Man. Been involved in clinical trials. We recently concluded the Sycophant clinical trials on fractional dose of COVID-19. But I want to focus on the administrative part of it, which is my background. He has done, under his leadership, the lab complex was upgraded. The lab complex houses most of the laboratories in NIPRD. Other facilities like the DMU, the drug manufacturing unit, operational vehicles were provided for all the departments in the institute, making it easy for movement for the departments. Members of the department can easily now attend meetings without having to jump into commercial vehicles. He also provided staff welfare buses for staff. Staff who need can apply and have access to those buses. Let's also talk about his efforts in capacity building. He had also ensured that almost every staff of NIPRD had had one form of training or another. In fact, as at last year, about 20 staff of NIPRD were trained outside the country, cutting across disciplines. So he has also done well in capacity building. Then, when he came in, one of the early things he did was to ensure that every staff of NIPRD had a laptop or a tablet, which has never happened before in NIPRD. And then, the zonal offices, it was under his leadership that NIPRD was able to launch out from Abuja. And we now have zonal offices in Lagos, Katsina, Anambra, and Jos. So I think he has done well.